Hey beautiful soul. Today I'm going to discuss an important case which is being discussed a lot on Reddit, and this is a patient who is showing his pictures and then asking the things which are being shown there. So people are labeling it as a poor hair transplant result and a botched up thing. But is it really just a poor hair transplant result or poor hair transplant planning? So if you also consider it as just a poorly executed result, then you may suffer the same fate because it is really very ill planned. Let's see how. So keep watching the video till end. You will get to learn a lot of things in this video. So as we can see the pictures, this is 11th month post-op picture of a patient who got his surgery done somewhere in Canada, and we can see the hair behind are thin. Transplant has been done only in the frontal portion. The color and texture of the transplanted hair doesn't really match the color and texture of the existing hair, which is quite obvious. Sometimes the donor quality at the back of head, I mean, because these are thicker hair, when you plant these hair in the front and if the nearby hair are thinning, you will see a gross difference between thickness and texture of these hair. Sometimes when we plant beard hair or other body parts here, they also may differ in texture. The angulation could have been better. The angle of the grafts, they are like little wavered. It could have been better, no doubt about it. Then if we see the gaps which are happening just behind the transplanted hair, this is again quite normal, and sometimes we see this even less than 11 months time also. Sometimes we see this thinning happening so fast that it you can see it in 4, 5, 6 months as well. So we don't know whether this patient was suggested any medication or not. Ideally in such cases medicines should be started because the thinning was too much, and we would definitely love to see the pre transplant pictures, or if we can have access to the transplant pictures as well. The number of grafts we don't know how many. Probably this was an FUE technique, and as we know in FUE technique we don't get the big numbers. We have to see whether this patient was a correct candidate for hair transplant or not. If the thinning process also affects donor area, and if donor thinning is something which is continuous and there is a significant difference in the donor thickness, what they used to be earlier and what they look like now, in those cases one shall not attempt a hair transplant. Now donor thickness improves on medication like DHT blockers, finasteride, and if finasteride is given, no doubt the condition of donor is going to improve, and so will the condition of transplanted hair. But yes, the result would be totally dependent on the medicine. Now we know you can have side effects because of medicine. You may not like to take the medicine forever. In those conditions you will face the problems, and maybe it is not a great idea to do a hair transplant in such patients. So there are few important questions which we need to ask this patient. Number one, whether he was suggested any medication post-transplant. Did he know that thinning can affect his transplanted hair as well as the existing hair and infect the donor hair? So if the medicine was suggested, at what dosage, and if wasn't suggested, then it should have been suggested. Second question is whether this thinning process affected the donor hair as well, because in case donor hair also get affected and there is a retrograde type of baldness which you see at the back of your head, those cases are not ideal for hair transplantation, as the thinning process will keep on affecting the donor, the existing hair and the transplanted hair. Yes, medicines can hold it back for some time, finasteride can help, but it would be totally dependent on finasteride, and we don't know how your body is going to react to finasteride. Okay, you may develop some side effects because of that, or maybe we know issues of dependence as well as tolerance. So it would be a good idea in such cases to start the medicine first, wait for around 3, 4, 5 months, and then maybe you can take a call. Many of such patients may not need a hair transplant at all, as you can see in these photographs where medicines were given, no transplant, and it filled really well. Because if you commit to transplant in such cases, you may end up in troubles like this. Another question, I mean, how much aware this patient was at the beginning of journey? I know people are apprehensive, they really want to get their hair back at any cost, but this fear, apprehension leads to mistakes, and I think that's what happened here. So I don't know whether the patient knew that hair restoration is a journey, it's not one point thing, it has to be planned. Another important question which we need to ask this patient, or for that matter anyone who is planning his hair transplant and chooses a particular clinic, this question is very important. You choose a clinic, you choose a surgeon on the basis of his work, but is it the real work of doctor, or is it boosted by medicine? Because finasteride can really surprise you, can act as a miracle. It fills up so many hair in those areas that sometimes 80% of the result which we think is hair transplant result, which is being projected as a hair transplant result, is contributed by the medicine. So if the medicine is started after the transplant, you may not be able to differentiate between transplanted hair, actual transplanted hair, and the hair which grew because of medicine. So this leads to confusion, this leads to unrealistic expectations which a patient can have from his doctor, and probably that's what happened here also. And this patient might not have taken the medicine, so everything went wrong, looks wrong. But had he started the medication, the same transplant, the same quality of transplant, same number of grafts, same maybe poorly done transplant would have looked awesome, because the medicine would have filled those gaps, medicine would have increased the thickness of existing hair, medicine would have grown a lot of softer and thinner hair in between the transplanted hair, and it would have looked like an awesome hair transplant. So, but medicine may not work in every patient in the same manner. It's possible that this patient might have taken medicine also. So I'm giving you generalized statements. So was this patient given any option about the medical treatments also? I mean, probably it would have been a good idea to start medical treatments before doing hair transplant in this patient. Another important question here, was he given options of FUT as well as FUE? Because these days what we see, there is a common practice all across the globe where they are given just one option of FUE, labeling FUT as an ancient or old surgery, which is not the case. FUT is highly skillful surgeon's job, which needs teamwork, years of experience, and it is something which cannot be expanded on franchisee model, which doesn't work well for every clinic. So in those cases, patients who have higher grades of baldness or who have progressive baldness, they should be given this option, because they cannot manage, no one can manage with just plain FUE, progressive baldness or high grade baldness. Again, when a patient sees results in grade 6 and grade 7 getting completely filled by just one technique, it creates a false narrative and fake hope in that patient's mind, and most of the times these results are contributed by finasteride and being labeled and shown as hair transplant result. So hey guys, if you don't understand this, you might end up in same situation in maybe immediately after transplant, 6 months after transplant, 11 months after transplants, or maybe 2 years after transplants. So all the results which we see, mostly they are like 1 year result, 1.5 year results, 6 months, 8 months. You don't see longer results, maybe 2 years, 3 years, 4 years, 5 years. You generally don't see. And medicines have their limitations, so one has to plan this strategy. So the take home message is, Hair transplantation is not a permanent solution. You must be knowing about the medical options. You must discuss in length, first of all. Second, you must know about the methods FUT and FUE so that you can plan your journey, and you will be needing both of them in due course of time. Third, the results which inspire you to go to a particular clinic or surgeon, you must evaluate whether these results are pure transplant results or they are contributed by the medicine. And it may be difficult for you to understand up to what extent these results are contributed by medicine. So it depends upon the dosage of medicine. Higher the dose, more would be the contribution. So 1 mg per day contributes a lot. As we reduce the dose, as you can see in this picture, when we reduce the dosage, the contribution from medicine also reduces, and it is directly proportional to the dosage of medicine. So with this, I end this video. If you have any suggestions or any questions, please ask in comment section. We would love to answer those questions. And always remember, hair restoration is a journey, not one point destination, and you have to plan it right. Now you can download an easy 7-step guide to plan your hair restoration journey. All you have to do is just click the link given in description and download it for free. Thank you. Love yourself. Stay blessed.